Good morning, Mr. President.
Good morning, Nancy Ann. I need your advice about how to sell our comprehensive health care reform package to the American people.
Well, I am the director of the White House Office of Health Reform. Maybe I can help. What's the problem?
Most people still do not believe that our comprehensive health care reform package will help them. They do not believe it will make their lives better or help them get access to better care at lower costs.
They are right. It won't do any of those things.
But we need to convince them that it will.
Well, start with the name. The real name of the health reform law is the Patient Protection and Affordable Care Act. People who do not like the law are calling it PPACA because it sounds stupid. So you should start calling it just the Affordable Care Act. And that will make people think it has something to do with making health care more affordable.
Opponents of the law say it doesn't do much to make health care more affordable.
They are right. The law doesn't have much to do with patient protection either. But the title sounds nice, and it makes people think Congress is doing something to help them.
The Republicans are saying that my comprehensive health care reform package will raise health insurance premiums.
The Affordable Care Act eliminates annual and lifetime benefit limits on most insurance products. It also eliminates pre-existing condition clauses and allows people to keep children on their policy until the child turns 26. And it removes patient cost sharing for preventive care services. All of those things adds to the price of the premium.
What should I say in response?
Just say that the Affordable Care Act is projected to reduce premium costs. Then when premiums go up, you can say that things have changed since the law was passed and blame the premium increases on Republicans.
Okay.
Also, be sure you tell people that now their preventive care will be free. People will like your plan more if they think they are getting things for free.
We promised the people they would be able to keep the coverage they have if they like it. These changes significantly alter the nature of their coverage and will raise the premiums. We are essentially making them buy different and more expensive coverage.
It's true that most people actually like their current coverage and do not want it to change. So to make the Affordable Care Act more popular, you need to keep saying that people will be able to keep the coverage they have if they like it, even though that is not really true.
What if employers decide to stop offering insurance coverage? Can we make them offer it?
No, but we can give them a waiver that lets the employer get out of the Affordable Care Act requirements for a couple of years. The Secretary of Health and Human Services has already granted 222 waivers affecting 1.5 million enrollees.
You mean my comprehensive health care reform package is so great that we have already let 1.5 million people out of its requirements?
Yes.
The Tea Partiers are saying that the new Comprehensive Health Care Reform Act is unconstitutional. And now a federal judge in Virginia has agreed with them.
That's because it is. If Thomas Jefferson sat down to read the Affordable Care Act, it is a certainty that he would be crying tears of blood by the end of it.
Well, what should I say about that?
You should label the Tea Partiers as mindless racist bigots. That will polarize the issue along lines of race and class, and will rally your minority base to support you. Then, discredit the court cases by saying that the governors and attorney generals bringing the cases are conservative wingnuts who are abusing the court system to further their own political agenda. And take every opportunity to point out that Judge Hudson is a Bush appointee. People will think his ruling was based on his politics.
But is there anything at all in the new law that actually addresses the affordability of care?
Not really. There is a provision for comparative effectiveness analysis of different therapeutic approaches. And there is a provision for bundling payments instead of paying fee-for-service.
What does that mean?
It means the law doesn't do much to address the affordability of care. Hope and dreams is what leading healthcare economist Yuval Reinhardt called it.
I understand the law lets the government experiment with new payment models. Does it let the private sector experiment with such new models as well?
No. In the private sector, only the existing payment models that reward inefficient and unnecessary care will continue to be clearly legal.
Why can't we let the private sector experiment with new models as well?
That would defeat the purpose of the law. The purpose is to have the federal government think up new ways to reimburse healthcare providers. Once the government has thought up the new ways, we will decide which way is the best and make everyone use that way. Then we will be able to say that the federal government is making things better.
Shouldn't we do something about the actual price of care? Doesn't having affordable care mean care will be less expensive?
No. We are making care more affordable by making people buy health insurance to spread the price of care across a broader segment of the population. That way doctors and hospitals can keep charging the same amounts.
What if people don't have enough money to buy health insurance? What if people want to buy something else instead of health insurance?
They have to buy health insurance, whether they want to or not. That's part of the Affordable Care Act too.
Do they at least get to choose what kind of coverage they want?
Yes, as long as they choose one of the standard plans we have approved for them to purchase.
What happens if they don't want to buy health insurance?
The federal government will impose a monetary penalty on them.
You mean we are going to punish people who don't go out and buy what we want them to buy?
Everyone wants to buy health insurance, even if they don't think they do. The Affordable Care Act makes people buy something they really want to buy, even if they thought they wanted to buy something else, or thought they didn't want to buy anything at all. And if they don't have enough money, there is always Medicaid.
I'm really feeling like this is going to be difficult to sell to the American people.
Then make a scapegoat. Say that insurance companies are evil, and that their executives are greedy, and make too much money.
The ratio of health insurance executive compensation to company revenues is comparable to executives in the broader market, and lower as compared to executives at larger healthcare providers such as hospitals and healthcare systems. And the 2009 earnings margin for health insurers was only 3.4%, compared to 5% for community hospitals during the same period. And recent research suggests hospitals have been able to use their position in the community to negotiate higher prices that are not consistent with the value of the services they actually provide. And
all of that is beside the point. Just say that health insurance executives are greedy. Just say that health insurer practices are abusive. The more that people dislike health insurance companies, the more they will like the Affordable Care Act.
These abusive health insurance companies are the same companies we are going to make people buy health insurance coverage from. Isn't there anything out there that could actually bring down the price of healthcare?
Not right now. The pervasiveness of the third-party payer structure significantly attenuates the ability of healthcare consumers to exert any downward price pressure on healthcare providers and suppliers. Congress could have enacted healthcare reform measures that would reintroduce genuine competition to the healthcare market, but instead they opted to expand and cement in place an archaic post-war system that encourages overuse, inefficiency, and errors.
That won't fit in one tweet on Twitter. Can you restate that idea under the 140-character limit?
Patients are all but powerless to demand lower healthcare prices, and the Affordable Care Act does nothing to help them.
But the patients are the people that ultimately have to pay for the services. Even the services we are telling them are free. So I will start calling it the Affordable Care Act from now on.
Have a great day, Mr. President.
Thank you, Nancy Ann. You've been a great help.